Tom Waddell as long as I've been in San Francisco, which is 15 years. I love that it's a free clinic for people that couldn't get health care otherwise. They're an amazing place.
My doctor says, I have this pain management class I would like for you to check out. I was apprehensive at first. She says, you'll like this one, try it out. And I love it.
In 2015, there were about 22,000 opioid overdose deaths in the United States. That's about 60 a day. California as a state has the most opioid overdose deaths. There were about 330 in San Francisco from 2010 to 2012, about 95% of which were from prescription opioids. This was over 2 times the national average. Most of the deaths occurred among poor people in San Francisco, and they were concentrated in poor neighborhoods such as the Tenderloin, which is where this clinic is located. Chronic pain is more common than diabetes, heart disease, and cancer combined. It's the most common reason that people access the healthcare system.
There's really a stigma around chronic pain and people that live with chronic pain that they're just trying to get high. The issue is that they're just trying to find some type of relief. The leadership in San Francisco Department of Public Health looked at these results and said, we really need to do something.
The Integrative Pain Management Program was launched in 2016. The vision is that every patient in the San Francisco Health Network in primary care who has chronic pain will have access to non-medication treatments.
I went from being so physically active to such an extreme level where I couldn't walk at all. I felt pain everywhere, chronically, every day, all day long. They were looking for a diagnosis. They were trying to figure out what was causing all that pain, but they couldn't find it. I was on pain meds for about 4 years. I started with 800 milligrams of ibuprofen and ended up on 275 milligrams of morphine. The nurse said, you would be a great candidate for this new program they're starting here. The goal is not primarily to get off your pain meds, but they help you in a holistic way to learn how to manage your pain. It's like dropping another drop in the well,
I have spinal stenosis. My chronic pain started in 2006. Now that I'm older, the chronic pain is even worse. When you wake up in the morning and all you think about is pain, you get agitated because you have other things to do. And you're in pain all day long. Medication does not make that go away. And when I get home, I just sit in one place and there's no relaxation. And when you try to explain that, it's very difficult.
Our framework for treatment of chronic pain is the biopsychosocial model, which posits that there are physical factors that may lead to chronic pain, such as tissue injury. But the patient's psychological state, including thoughts, emotions, and behaviors, contribute greatly. The standard of care now is to use multimodal treatments.
I would describe it as a holistic approach to treating people with chronic pain, body, mind, and spirit.
Our groups are 12-week series. We start out with an introduction to what is pain and how pain works in terms of it's something that's mediated through the brain.
I am not so anxious no more.
Each week we offer a session focused on thoughts and feelings, communication, relationship building.
Think about it. Even if it's pain, I'm walking with her.
We talk to each person and have them present what their issues, what their goals, what their intentions are. A lot of the people that we serve are very isolated and don't have family and don't have friends or have to live in the streets where they have to be really tough and self-protected. My job is to really kind of break down people's defenses and create an openness.
To get to know different peoples was just awesome too, because just knowing that I'm not alone in pain, and that's what made me feel at ease in the group.
Total difference. It's a big difference.
This group right here has changed you. You're doing pretty good. I never thought I would experience a group session with different people of all types of nationality, all colors, and all ages. We didn't have anything to hide. It felt good to express.
The groups incorporate acupuncture, massage, mindfulness, and movement. There's lots of different activities or practices that participants can engage in, try. We don't push anybody, but we give them the option, and then the testimonials from their peers gives them that extra push to try something that they might not be familiar with or maybe have some resistance to for whatever reason.
My favorite parts of the program was the movement, pain movement. I never done that before, so that's new for me. We did a lot of exercises.
It's good to be mindful, and they remind us of that. When you're in pain sometimes, you're very, very anxious, but we've learned to be very patient with that and not focus on pain.
I've learned to pace myself, and the massage was awesome. They located every area that I said I want attention with, my neck, my back, and my shoulders. I just melted.
Before I started receiving acupuncture on a regular basis, I had really bad night sweats. They helped me take care of that. They've been helping with cramping, muscle pain, restoring your body to harmony. I love the fact that our acupuncturist and meditation instructor is also a part of my transgender community. There's a level of comfort that I feel.
After graduation next Wednesday, you can come to the graduates group starting next Thursday. We do some of the same kinds of things that you do in this group, so you'll have to check it out. We started the group because the first people that went through this program, they said, what on earth are we going to do when this program's over? I want to reassure you that it doesn't end here.
It's important that I continue on with the graduate group because it keeps a person's hope up and keeps them going, takes the focus off of the pain, and teaches us how do we manage the pain.
I think about the pain management class with the group session talk, and all of a sudden my brain just kind of like calms down, and I'm Valerie, taking care of my business.
I was saying at yesterday's group, your pain is my pain, your suffering is my suffering. And then somebody chimed in and said, and my joy is your joy, and your triumph is my triumph.